Starting with MCQ 118, a neutropenic hypotensive patient admitted in oncology ward with history of dysuria and high-grade fever. His blood culture yielded growth of Plasmodium aeruginosa. These findings suggest that the disease is a result of excessive release of which of the following, तो it is tumor necrosis factor. ठीक है, जब भी ये हमारे पास एरोजिनोसा होगा, सुडोमोनास एरोजिनोसा, तो ये क्या है हमारे पास ट्यूमर नेक्रोसिस फैक्टर की वजह से है. टाइट सेल ऑफ द एड्रिनल ग्लैंड पेरेंकाइमा रिलेटेड टू विच ऑफ दीज, तो it is related to mesothelium. A 68 years old male has copious amount of fluid in the left pleural cavity due to acute pleurisy. When you examine him, he sits up in the bed, trunk upright. Where would the fluid tend to accumulate? So it accumulates in the costodiaphragmatic recess. Urorectal septum separates rectum and the urogenital sinus. A patient has gonococcal urethritis. If not treated, it will lead to epididymitis. Prolactin-induced hyperprolactinoma occurs due to decrease in dopamine from the hypothalamus. Dopamine is prolactin inhibitory factor. If dopamine is decreased, then prolactin will increase. An old patient presented with fatigue, weakness, and dyspnea, with labs showing decreased calcium levels, increased phosphate levels, and increased CREAT and increased parathyroid hormone. In case of, so it is end-stage renal disease. Structure crossing superficial to the flexor retinaculum is tendon of palmaris longus. What to give in hypothyroidism? So it is levothyroxine is given in a patient who is suffering from hypothyroidism. Young girl, oral bleeding, gingivital swelling, petechiae, lower lip paresthesia, CBC, and bone marrow biopsy is advised. What is the most likely diagnosis? So it is leukemia. Which of the following vein dilated in portal hypertension? So it is left colic vein. Clear? Which of the following causes thrombus formation? So it is endothelial injury. Clear? In varicose striate, thrombus consists of stasis of blood flow, hypercoagulability, and endothelial injury. Clear? Which of the following is responsible for uncoupling of oxidative phosphorylation? So it is thyroxine. Clear? नॉरएपिनेफ्रिन फॉलोड बाय थायरॉक्सिन. तो अगर नॉन एपिनेफ्रिन नहीं आपको मेंशन तो आप क्या करोगे? थायरॉक्सिन. विच ऑफ द फॉलोइंग मसल इज फ्लेक्सर ऑफ द थाई एट द हिप जॉइंट? तो इट इज सॉस मेजर. Cerebral aqueduct arises from mesencephalon. Clear? It arises from mesencephalon and it is present within the midbrain. ठीक है, ब्रेन स्टेम में मौजूद होता है. C8 is present in posterior cord. The highest content of triglycerides are present in chylomicrons. A 16 years old female presented with hypertension and increasing weight. Which of the following features would be most suggestive of Cushing syndrome rather than simple obesity? So it is proximal myopathy followed by abdominal stereo. Regarding O negative blood group, so it has no antigen in it. A 40 years old man with back pain, apple green pharyngitis and Congo stain is positive on damage to the kidneys with monoclonal antibody is present. Most likely he is suffering from multiple myeloma. The temporomandibular dislocation, what structure prevents the joint to go back in cavity? So it is lateral pterygoid muscle. Loss of accommodation reflex lesion in which area? So it is cerebral cortex.